toxoplasmosis was negative, which is wonderful news. I left that message on your machine, so that is good news. Yeah, so you can take a deep breath on that one. So yeah, we were very happy to get that back.
Wow. Alright, so what's your name?
Dr. Brian Hunt.
How long have you been doing your veterinary career?
I've been a veterinary graduate for about 40 years.
40 years?
Graduated in 1968. That was my last year. Got my degree in 69.
Okay, so what is this room?
This is the operating theatre. And we have these fancy lights, just like they use in human medicine. These are Ritters, very advanced. They give you very good lighting so you can see exactly what you're doing. Over here is an anesthetic machine. It's a human one that's been adapted for animal use, because that is the best you can get. They have better flow rates in human machines, and once we get them adapted, they work perfectly well on little pets. This one was actually set up by an engineer who worked for a board-certified surgeon and ophthalmologist. And so,
what kind of animal do you prefer to work with?
cats and dogs. This patient here is Herbie, and we're going to perform an examination on Herbie. First off, we check the kitty over, take a look to make sure everything looks normal. Then we examine the mouth. They usually don't like this. Check the gums, mucous membranes, look at the teeth, check the eyes, check the ears. Palpate the kitty. It's okay, Herbie, you're fine. There you go. And then we listen to the respiration and listen to the heart rate. Herbie has a good heart rate, it's running about 130 a minute. Listen to tummy sounds, breathing sounds. At this stage, a lot of cats start purring, they enjoy it. Sometimes it's difficult then to hear without waiting for them to stop. You're in good shape, aren't you, Herbie? If we need to proceed further, then we take blood tests. We insert a needle into the jugular here, drop some blood and send it off to the lab, and they examine that for both hematology and for chemistries. And from that we can tell how the organs are functioning.
Cats and dogs, okay. When you become a veterinarian, when you get your degree and your credentials and everything that says you are a licensed vet, are you allowed to solo practice at your house, at your home?
You have to have a licensed premises to practice out of. So the premises has to be licensed by the state board and also locally by the local.
What did you have to learn, like what did you have to major in school to become a vet?
In school, we had to do chemistry and physics, science subjects, mathematics, and we needed a couple of other subjects to mainly get our 6 A's so we get into vet school. I did those in history and economics.
Okay. What do you do if people can't pay for their treatment or surgery or bills in general when the animal's in need?
Well, usually we have a payment plan. We don't see too many emergency cases. They're referred to the emergency hospitals, and they have payment plans as well. So it's usually not a great problem. Usually if they don't have any money, we give them emergency treatment, and then they have to make a decision as to whether we can keep treating the illness with chance of survival, or if the trauma is too great that they have to be put to sleep, So they need to make that decision. It's tough, yes, and we give them an injection dose of anaesthetic and then just overdose, and they go down fairly peacefully. It's like going under anaesthesia. So it is traumatic, and some clients are very traumatized by it.
Naked.